Hello, I'm Suman, and today I'm going to conduct a psychosocial assessment for my client Rebecca Kelly, who is 19 years old. She has a history of drug-induced psychosis and amenorrhea. So right after her discharge from the hospital, her parents noticed a drastic change in her eating habits and a drastic weight loss. So that's when she was taken to a GP, and then GP has accordingly asked me to conduct a psychosocial assessment on her in order to collect some baseline data. So this assessment will help us in drawing a picture of Rebecca's strengths and her protective factors, and also identify specific risks and then come up with nursing interventions for her. So I'll be basically focusing on the 10 domains such as home and environment, education and work, activities, drugs and alcohol, relationship and sexuality, conduct and risk taking, anxiety, eating disorder, depression and suicide, and psychosis and mania. So without further ado, I would like to call Rebecca. Hi Rebecca, you can come in. Please have a seat.
Thanks.
Hi Rebecca, I'm Suman. I'm a mental health nurse in this clinic. So do you know why you are here today? Okay.
I don't know why.
So we are conducting a psychosocial assessment. Do you understand what that means? No? So basically we'll be talking about things like what you like, what you don't like, what you're up to, what things are going on with you. Okay? Does that sound okay?
Sure. Yeah, okay.
Alright. And then whatever we talk and whatever we discuss in here remains between you and me. It's confidential, meaning it won't be shared with your family, it won't be shared with the doctor or anybody else without your permission.
Okay.
So the only time I will be breaking the confidentiality is if I find out that there's a risk to yourself, if there is risk to others, or if there is any crime or anything involved, then I might have to break the confidentiality, but then I'll have to ask your prior permission.
Okay.
Okay?
Sure. Okay.
And then in between the discussion, I might ask you some sensitive questions, and then you might feel inappropriate or you might feel you don't want to answer it. Just let me know, okay? We can stop right there.
Okay.
Does that sound okay?
Sure.
Are you happy to start?
Yeah, okay, yeah, go for it. Yeah.
Okay. So where do you stay, and then whom do you stay with?
I'm just living at home with my parents and my little sister. She's really annoying.
So how is the relationship with them?
I guess it's a bit strained. My parents are just so controlling and bossy. They just have to make all my decisions, and I can only suppose living with my parents still, that's what I can expect, but I can't wait to move out.
So what do you guys quarrel about?
Well, they're always just telling me what I've got to do, how I need to eat and stuff, and they're always just telling me they're just so controlling. I'm an adult, I can make my own decisions.
Okay. So are you working or are you studying?
I'm at uni at the moment.
Uni? So what are you studying?
I'm studying exercise science.
Oh wow. So how is it going? How are you finding it?
Yeah, it's good, it's interesting, and it's given me good tips on exercise, so.
So you're finding overwhelmed with the new uni, and then how are you keeping up with it?
I mean, the workload's alright. It's been a lot this semester. I don't know, I've got to get good grades, and I don't know, I can't concentrate, I can't get all the work done that I want. I'll just be so tired all the time. So much work.
So have you been sleeping well? Studying more, and then
Well, for the most part, sometimes I can't sleep, but for the most part, I actually end up sleeping when I should be doing my uni work. I'm just so tired.
Have you talked with anybody else about this thing?
No.
No? Do you think I can help you with it?
Yeah, I mean, I guess. I just plan to work harder. I have to work harder if I want to get good grades.
I'll take note of that. So what about things? What do you do when you're alone or when you are with your friends?
When I'm by myself, I'll just exercise. I have to exercise. It's important.
So you don't go out with your friends?
Right now, not so much. Not
Okay.
anymore, no. We used to go shopping, but we don't anymore.
Alright. So what do you think about drugs and alcohol?
I don't drink or anything. I don't
No?
smoke, no.
So you don't have any friends who drink or smoke?
I mean, my mates, they'll go out sometimes, my friends, but I don't really have time to hang out with them. You know, I've got to
Okay.
study on my uni work and focus on everything else.
Mm-hmm.
Prioritize.
All right. So, are you in a relationship or are you dating anyone?
Yeah, my partner, he's amazing. We're high school sweethearts.
How long have you been dating?
Over a year now. Yeah.
Can you describe me like how is your relationship with them?
Oh, he's really sweet. He's very supportive, and sometimes he'll come to the gym with me.
Mm-hmm.
We'll exercise together.
So happy to be with him?
Oh yeah, absolutely. Yeah.
Mm-hmm.
I'm very happy.
What about like risk-taking behaviors? Have you taken any of it? Like, have you ever tried to hurt yourself or hurt others?
No.
No? And you mentioned that you have your partner. So, what about, do you use protection, like have safe sex?
Well, I mean, sometimes he'll use a condom, but honestly, I just feel like we're not really concerned about it. It's not an issue.
No?
I don't think it is anyway.
Do you have your regular periods?
Oh. Actually, it's been a while since I've had my period. I don't know when, maybe 3 or 4 months ago? I don't know.
So have you checked or like talked with anybody else with this?
No.
No?
Because I'm not really bothered by it. It's not a concern. Like, even better, I don't have to deal with the period. Great.
Mm-hmm. So what about like, do you know what sex education is? Or do you have...
Oh yeah, the stuff they teach us in high school, right?
Mm-hmm.
Yeah, I remember some of it, I guess.
Mm-hmm. Maybe, is there something like I can talk more at the end? We can talk and discuss more on that?
I mean, if you want, sure.
Sure, okay. So, what about, do you get anxious often?
I'm just anxious sometimes with my uni work. Thinking about the amount of work I've got to do just gives me anxiety.
Is there any other situations where you get anxious or...
Situations. Oh, I guess when I did hang out with my friends, I just felt like they judged me all the time. Like, they just judge how I look and everything, and I just feel like sometimes they're not my real friends. Yeah, it would make me very anxious.
Why would you say that?
I just felt like everyone was judging me and how I looked, and I don't know, I'm so fat. Like, I just want to lose weight, and I've been working towards it, and I've already lost 15 pounds, but I need to lose more weight.
So you're saying you're very concerned about how you look and then how much you weigh?
Yeah, I mean, this is why I don't go shopping with my friends anymore. I can't wear all the popular clothes or anything like that, and I just can't be around those type of people.
So is that why you don't hang out with your friends?
Yeah, I guess that's part of it, and then I just don't have time.
So what do you do to like maintain your weight?
Well, I eat a lot of vegetables. It's really good. It's important. I know that. They talk about it in exercise science. So maybe I'll also have ice cream or sweets to reward myself, because I've been working really hard and I just need that incentive.
So apart from exercise and eating vegetables, what else do you do to maintain your weight? Like to avoid any particular foods, or are you on a diet pill?
I avoid carbs. Cannot eat carbs. Carbs are so bad.
You think it's bad?
Oh, absolutely. I can't eat carbs. I do eat vegetables, which is good, and I exercise. I know that's really important. And I don't take any diet pills now.
No? So you think vegetables are enough for you?
Yeah, I think so, yeah. I mean, they're very healthy.
Do you feel healthy?
I guess, yeah.
Okay. So you also mentioned that you are stressed with this uni workload, and then also like get anxious with people around.
Yeah.
So do you feel sad or lonely when you're lonely at home, or even when you're uni? Do you feel lonely?
No, not really.
No?
Not really.
So you don't have difficulty sleeping or anything like that?
I think, as I said before, I think on rare occasions I've had difficulties, and that's when I'm very anxious and thinking. But most of the time I'm just so tired. It's hard for me to even stay awake during daylight hours when I'm supposed to be doing uni work. I just don't have the energy.
Maybe you're not eating well? Maybe it's because you are not eating well. You've just been eating vegetables. Maybe it's because of that.
Oh, okay.
Maybe I can help you with that. Yeah.
Sure.
It could be the reason you're not able to concentrate on your studies and you're feeling weak, not being able to study well. Yeah.
Okay.
Right. And then people, like most of the people I have worked with, young people I've worked with, they say that when they are stressed and anxious, they like sometimes hear and see things. So have you experienced anything like that?
No, I
No?
haven't, no.
So don't you ever feel like you have some superpowers and then you can change things around?
That's silly, no.
Oh yeah, I know that. Oh. So like, thank you so much, Rebecca. This is the end of our assessment. So throughout the discussion, like I have gathered enough information about you, and then to me, you seem like a very bright and a very hardworking girl.
Oh, thanks.
It just seems like you are overwhelmed with all the things that's happening around you,
Okay.
and then there are surely a couple of things that I can definitely help you. Like you mentioned that you are stressed with uni, and then you're unable to like manage time, and then unable to concentrate on your studies.
Okay.
So I can probably like refer you to a uni counselor who can sit with you and then like come up with some good study techniques and then help you keep up with your grades.
Yeah, that would actually be good. Yeah,
Okay.
I didn't think of that.
Yeah. And then the second thing you mentioned was that you have missed your periods for 3 to 4 months,
Yeah.
and then like you had a couple of unprotected sex with your partner. So maybe like I can refer you to a gyno or a sex health worker who can like do some like give you some education or like do some tests to protect yourself and also your partner. Does that sound okay?
Okay, sure. Okay. Alright.
All right.
Yeah.
And then it also seems like you're very anxious about everything that's happening around you, and then like people judging you. I think this is making you more and more anxious and then troubling you, and then it could be the reason you are like avoiding people and staying home alone. So maybe I can refer you to a psychologist who can
Okay.
like work with you and then like come up with some stress management techniques and then
Okay.
help you with that.
Sure.
Yeah.
Okay. Yeah. Alright.
And then you said you seems like you really like doing exercises, and then also you are eating, but then you are in a growing age, and then like you have to have like enough vitamins for your body requirements, body growth, you know. So as much as you love exercise, it's also important that you get enough like nutritional foods. So I would really recommend you to like go and see a nutritionist. So I can probably refer you to a nutritionist who can like come up with a healthy diet plan for you. It doesn't have to be like carbs or anything, but then a healthy one which will help you like keep yourself healthy, and also this can also help you like concentrate on your study and then give you energy to study. Does that sound okay?
Yeah, okay. I'll give it a try.
All right. So
All
are you
right.
happy to see me next week?
Sure. Okay.
Yeah.
Yeah.
Okay, I will talk with the doctor and then also like make appropriate referrals for you. So in between, like if you feel like if you have any questions or if you feel like you want to share something that you haven't told me during the interview, during the discussion today, you can always give me a call. Okay, Rebecca?
Sure. Okay, thanks.
Thank you so much for your time, Rebecca.
Yeah, okay. Thanks.